Paychecks are finally starting to flow to some home health care workers who've not received a nickel since June 1st, even though they've been on the job. We began investigating this crisis a week ago.
Well, today, the worker that we first profiled received a check. But as reporter Jeff Hirsh showed you first on Local 12, the troubled system is far from fixed, and a lot of people are still scared and without pay.
Try and relax just a little bit.
Billy Lauterwasser has been helping Janet Mason the past 3.5 years as her home health care aide.
How's that feel?
Thank you so much.
But Billy may have to quit soon to look for another job.
I haven't been paid since the 1st of June, and it's very stressful.
Like many independent health care aides around Ohio, Billy is caught in a system which is not working. The state of Ohio's switched from paying the aides directly to having insurance companies take over the program and the payments, which have not been coming. In Billy's case, around $4,000.
I've been having to borrow from my parents weekly, and it's been almost 2 months now, and I can't hold out much longer. I can't keep asking my parents for money.
They're going to have to quit and get other jobs because they have no income, and they don't know when they are going to get paid or if they're going to get paid.
Janet has another big worry besides losing her home health care aides. Local 12 News has reported that one health supply company is refusing to deliver products until they get paid by the insurance carriers. And if that spreads?
I'm afraid that that's going to happen. You know, what's going to happen when they say they're not going to send them to me anymore? My oxygen, you know, if they say they're not getting paid either, I need my oxygen. I'm on it 24/7.
That oxygen is still flowing for now, but there are still plenty of people and businesses in limbo. Patients worried about the future of their health care.
I just think this was a terrible idea.
And providers worried about their futures too under a program which has gotten off to a terrible start.
It just needs to be resolved ASAP.
The healthcare nurse we first profiled, Tammy Talby, told me today that she is, quote, beyond happy right now because she finally received the $5,000 plus that she was owed from Aetna Insurance. Talby works for a couple in Butler County taking care of their 51-year-old daughter who has been brain damaged since birth. Like many other aides, Talby had not been paid since June 1st and was afraid she would have to quit to find another job. Since running Talby's story, Local 12 News has been inundated with calls from other providers and agencies who have not been paid either. We passed Talby's name along to Aetna and are doing so with other providers and agencies as well. The state Medicaid department has also asked us for the names of those who have not been paid yet, and we are passing those names along as well, only of course with the permission of the providers. Back to you.
All right, Jeff, great work. Thank you. The payment crisis began in our area June 1st after the state had insurance companies take over payments for around 100,000 patients eligible for Medicaid and Medicare. We first reported how independent providers were impacted, then showed how healthcare agencies, suppliers, and some nursing homes were not being paid either. Aetna Insurance has admitted problems within their systems and is now speeding up processing and running payment checks twice a week instead of once. The company says it is also offering cash advances to some providers who are facing financial difficulties.